Okay, I will once again knock before entering the patient's room. This is my insulin administration video. I am going to perform hand hygiene before entering the room. I've done that, made sure to clean my hands. I'm going to go ahead and confirm that the patient doesn't have any allergies other than what I have listed here. Hello, Melanie. Your last name, what is your last name? Okay, it's Barnes. Okay, good. You're the right person then. Okay, it looks like your birth date was, what was it? Okay, yeah, 7/19/77. Good. You're who I thought you were then. I appreciate your answering that question for me. Yeah, I know. I see you every day. I should know it by now, right? But we still have to ask just to be sure. Do you have any allergies? Oh, Percocet. Any others? No others. Okay. Well, that's good. I'm not going to give you any Percocet today. Today I'm here to give you insulin. And how have you been feeling lately? You feel like you've been okay? Okay, just wondering. And your food's probably getting close to ready by now. I'm going to go ahead and put on my gloves here. And then we're going to give you those shots. Yeah. I'm going to give you one in the arm, and I'm going to give you one in the belly. Well, because you want to have them in two different spots. Sometimes you don't want to overload one spot with too much medicine. So I'm going to go ahead and I'm going to wipe this alcohol on you. It'll clean up your skin so we don't push anything into you and give you risk for infection. Maintain the patient's privacy. I'm going to go ahead and raise your bed up here. Okay, that's the one that raises your bed up. Go ahead and raise this bed up all the way that we need to. Make it easier to do. Yeah, it's one thing doing your finger, but it's another going to your belly with that thing all low, huh? Okay, now I'm not going to leave your side here, because I don't want you to fall. So, go ahead and lower the rail. And I will get this alcohol swab here, and let's go ahead and let's see, we got 4 units of levemir going in. I guess I'll do that one in the belly. Probably, yeah. Okay, maintaining the patient's privacy as best I can. Okay. Look, you have a Band-Aid from yesterday. That's nice of them, huh? Okay, well, go ahead and remove the Band-Aid. Since the Band-Aid was nicely marked on the site, I'll choose a new site, go in a spiral out from 2 inches from my new chosen site. I will leave an alcohol swab on the site to mark it. Okay, I chose the site just a little bit away. I've actually decided for this one, I'm going to give the 10 units because the abdomen is larger, has more subcutaneous tissue, so I should do that. Okay, I left my alcohol swab there to mark my site. I cleaned it. Okay, well, this isn't the funnest thing in the world, but I know you're used to it. Okay, let's go ahead and give you that injection. Okay, remove my alcohol, let it dry for a moment. Injected it. Okay, I didn't actually inject it into the stomach because that wouldn't be a good idea. But I will then grab don't leave any trash there. But go ahead and place this directly into the sharps container now, because it is a sharp. And I will go ahead and get another alcohol swab to do the other injection. Okay. It was a little bit silly for me to inject, or I lowered this one then injected from that side, but I made sure to keep an eye on the patient and make certain that she wasn't in any risk. If she was, I would have raised this back up. But, you know, she was with me the whole time. Okay, now this, yeah, I think you can see. So I'm going to go for some of the subcutaneous tissue down here under the arm. It actually doesn't have a soft spot. If the patient had a small amount of adipose tissue, well, to be honest, these things are pretty, they're pretty short, the needles on the pen. Okay, go ahead and have the patient hold her arm however she can if she's able to, and she is able to hold it up there for me so I don't have to hold it. I will go ahead and I primed it earlier. Now I have to set it to the 4 units that I want to give, and I will pull off this cap here. That is dried. I had left the alcohol swab there, but of course it fell off of the dummy. But I know exactly where the mark was. I kind of rotated it around the site, but I did see a freckle right in the area where I was going to go, so that helped me identify it. Okay, well, and then and that was it. I didn't really do it on the dummy, but I definitely would have pulled the skin taut on a real patient. The patient doesn't have any skin, so there isn't really anything to do with it, but I wouldn't want to have the medicine on the surface of the skin. That would that would mean there wasn't any medication that's actually administered. Having done that, I will let the patient know the procedure's done. Okay, well, we're done here. I'm sure you've had it done before. I will put my needle in the sharps container. This pen belongs to the patient, so I will go back and put it in the med room. I will document what I gave. So blood glucose was 180, and I gave the regular insulin, I gave the NPH, I gave the Levemir, all subcutaneously, and I gave the NPH and the regular abdominally, and I did the Levemir in the arm. Okay, if there's any bleeding going on here at all, I could put a cotton swab on there, and or I could put a Band-Aid on. Same thing as the blood glucose level. Go ahead and clean up after myself, put everything away. I am putting the rail back up, make sure the patient can't fall, make sure the patient can reach the call light, and lower this bed back down. Make sure the patient is comfortable. Make sure they're not feeling any complications from their shot. Also, before I did give the shot, I don't think I mentioned it, but I did examine the site and make sure there wasn't anything going on that would contraindicate me giving the injection at that site. You know, any inflammation, any redness, any breakdown of skin, anything like that, I wouldn't have done it. But there wasn't, so I didn't have to worry about that. You can go ahead and I think I already said this, let the patient know that I'm done. Ask them if there's anything else they need, make sure to get their food into them. If I'm not seeing their food in another couple of minutes, maybe I'll go down to the kitchen myself, knock on the door real loud, be a jerk to them, and get her food up here. I mean, be a jerk to them. Not really, but okay. Okay, well, I've documented it, did my 6 rights. I did a check outside the room, a check in the room, a check at the med cart. Yeah, I did my 6 rights. I made sure that she understood why she takes insulin. You know, if I've seen the patient a lot of times, I wouldn't need to keep doing that every time, but I would make certain that she has a good understanding of her her condition. Make sure she can reach the call light. Make sure I maintain her privacy the whole way, and otherwise, wish her a good day and move on to my next patient.